Immunity plus cardiovascular disease. Have you ever thought about your heart and blood vessels associated with your immune system? Well, if not, you're going to think about it now, because that's where we're going in the Big Bold Health discussion of how your immune system connects to your cardiovascular system. Remember, you have these miles of vessels called your blood vessels and your arteries that travel and conduct your blood throughout all organs and tissues of the body. And those are lined by one cell thick lining called endothelial cells. And those endothelial cells have been found to communicate with the white blood cells of your immune system that are traveling through your blood system, your arterial and venous blood. And therefore, your arteries are in constant communication with your immune system. If the immune system is angry, meaning inflamed, then it's going to impart that message to the endothelial cells that line these arteries. And those particular cells are going to pick up the message of, ooh, all is not right here. We're going to be upset as well. In so doing, that translates the message then to the interior cell linings of your arteries. That then reduces the ability of that cell to function in its normal way. What does that do? That creates then the outcome of collecting fats into the artery wall, of collecting injury to those cells that form those debris like skeletons of the cells. They then get calcified because our body's way that it puts a cover over dead cells is to calcify them. So now you get coronary atherosclerosis, you get hardening of the arteries, you get increased blood pressure. You have all these things that come as a consequence of your immune system telling a message of alarm to your cardiovascular system. That can do with the heart and the arteries and all the things that feed blood to all the tissues of your body that are required. So we in Big Bold Health have a very important point to look at how one would get the immune system to speak a friendly message to your cardiovascular system. And that has to do with things that would lower those cell types of the immune system that are sending these alarm messages to your arteries. Things like Himalayan tartary buckwheat, things like our omega-3 fatty acids that contain vitamin D and vitamin A from cod liver oil, things like one of the constituents of Himalayan tartary buckwheat, which is called 2-hydroxylbenzylamine or 2-HOBA, which has been identified at Vanderbilt School of Medicine as being a very powerful substance to properly orchestrate the relationship between your immune system and your artery wall. All of these things become part of not only understanding some of the problems that relate to the immune system and cardiovascular function, but what to do about it, how we personalize it, how we use your immune identity that we're developing to then lead to a personalization of your immune approach towards remediation of an imbalanced problem that could create, in this case, the major cause of death in our society, which are cardiovascular diseases. So stick with us, be part of our community. We're going to be developing this. We're going to teach more how you assess and then how you intervene with powerful things like the polyphenols found in Himalayan tartary buckwheat or the omega-3 fatty acids or other specific agents that are known to properly balance the immune system to reduce cardiovascular risk function and improve immunity.